years old, and about 6 weeks ago I had bilateral surgery on my knees. The knees were custom made. Since the surgery, I've been really fully amazed at the fact that my recovery has been so easy. And that's the most amazing thing, is that 1 week after I had the surgery done, I was off of my walker. For the next 2 weeks after that, I did use a cane, but was not fully dependent on my cane. When I was inside the house, I went without it, and sort of, in the beginning, I sort of stumbled from pieces of furniture to pieces of furniture, but now I can walk upright and not need to touch everything along the way. I've been really thrilled with the surgery. It's been terrific for me, and my husband and I thought I'd be in bed for a month. And now I'm up, moving around, and he doesn't have to fix all the meals anymore. I had pretty serious arthritis in both of my knees. When I was a child, I was pretty sporty and did a lot of activities. For those of you who are about my age, you probably remember the twist, and that was one of the times that my knees went out. But I've just had trouble with my knee pretty much since I was 6 years old. And toward the end, it got to the point that I had trouble sitting and standing. And both of those things were very, very difficult for me to do, and I usually needed somebody's arm or hand so that I could get up from a chair. And during the time that I was sitting, I could feel there was just pain in my knees. When I came in to see Dr. Bonenberger, I had had a couple of shots in my knees to try and help my mobility. The first one was very good and lasted for about 6 months. The second one lasted about 2 months, and then the third lasted about 2 weeks. So my primary physician and I decided it was time we do something a little bit more drastic, because I didn't want to go through the rest of my life not being able to play tennis and having it hurt when I walk. I came to Dr. Bonenberger, and he looked at me, and we talked about the various kinds of things that we could do to help my knee. One of the options that Dr. Bonenberger and I discussed was having both knees done at once versus having one done and then waiting a little while to have the other one done. We had been scheduled to have the surgery earlier, but then Dr. Bonenberger decided that he wanted me to have the customized kneecaps. And so that postponed my surgery for about a month. And I was not happy about the surgery being postponed, but once I've had the custom kneecaps put in, I'm really thankful that he made me go through that extra month so I could be as good as I am today. The day of the surgery, we got in around 6 o'clock in the morning, and I guess by around 12, I was ready to go, and went over to the hospital, and my stay in the hospital was very, very easy. Good people, good nurses, but it didn't hurt. I mean, that was the nice thing. It really didn't hurt. People asked me, well, what is your pain level on a scale of 1 to 10? And I kept saying 2. Now, I don't know if I have a high tolerance for pain or if the medicine was working that good, but it wasn't anything near what I thought it would be when it came to pain. I don't have the pain in my knees anymore, which is wonderful. I mean, I do have, it's like I have knowledge that I have 2 new knees. You know, that's not going to go away for a little while, simply because I haven't been thoroughly through the rehab yet. And I have a feeling that once I've done that, and they push me a little bit further, I'll be pretty much back to normal. And I'll be really back to normal when I can walk the dog and have her tug on me a little bit. And when I